Welcome to Catawba Valley Medical Center, and thank you for choosing us for your procedural surgery needs. The purpose of this virtual tour of the surgical suites is to acquaint you with our facilities and procedures before your visit. It's our hope that you'll feel more at ease when you arrive after watching this presentation. It should also be comforting for you to know we have been designated a magnet hospital 4 consecutive times, the 23rd hospital in the United States to have achieved this recognition. This designation assures patients and their families that our nurses deliver the gold standard of nursing care. Your voice plays a key role in your care, so we want you to be aware of an acronym known as Speak Up. At CVMC, we believe in the points that are made by each letter in the word. We encourage you to put these points to work when dealing with your health and health care. S. Speak up if you have questions or concerns. It's your body, and you have a right to know. P. Pay attention to the care you are receiving. Make sure you're getting the right treatments and medications by the right healthcare professionals. E. Educate yourself about your diagnosis, the medical tests you are undergoing, and your treatment plan. A. Ask a trusted family member or friend to be your advocate. K. Know what medications you take and why you take them. U. Use a hospital, clinic, surgery center, or other type of healthcare organization that has undergone a rigorous on-site evaluation against established state-of-the-art quality and safety standards. P. Participate in all decisions about your treatment. You are the center of your healthcare team. When you drive to our day surgery department, enter the hospital grounds through the front entrance. Continue to the right side of the hospital, following the signs pointing to day surgery. For your convenience, there is a separate parking lot for day surgery patients. From there, enter through the day surgery entrance. Take the gold elevator to the first floor and check in with the receptionist. Your upcoming surgery or procedure was scheduled through the office of your healthcare provider, who is also responsible for scheduling your pre-operative health assessment. Based on your provider's preference, you'll either be fast-tracked, which is a telephone interview with one of our registered nurses, or you'll be scheduled to come to CVMC for an assessment with a registered nurse in our pre-anesthesia testing clinic. If you appear in person, please bring all of your insurance cards and medications. On the other hand, if you have a fast-track telephone interview, it is extremely important to provide all available phone numbers to your healthcare provider so you can be reached for the interview. Now let's assume it's the day of your surgery. Things you would want to bring along are your insurance cards, an updated list of all medications that includes the medication name, how often taken, and the dose. You may also bring a pair of slip-on shoes, such as sandals or bedroom shoes with non-slip soles. Please do not bring any jewelry or valuables. It's important that you follow the dietary instructions you'll be provided. The reason for this is that food and beverage in your stomach could lead to aspiration or stomach contents getting into your lungs. This can lead to serious complications, so for your safety, please follow these instructions or your procedure may be delayed or canceled. Your preoperative interview nurse or physician will advise you of any medications that you should take the morning of the surgery. The day of your surgery, check with the receptionist, who will establish and maintain contact with your family while you're in surgery. Upon contact, your family member should return to the receptionist desk to receive messages or perhaps meet with a physician for a surgery report. Once you are checked in, your nurse will arrive to walk you back to your day surgery room to prepare you for your procedure. If you like, 2 family members or 2 visitors may accompany you. If you are scheduled to be admitted to the hospital after surgery, leave your suitcase in the car and have your family deliver it later to your assigned room. Surgeries may be started early or possibly delayed depending on what happens in the surgery suites. We apologize for any inconveniences that may cause, but once again, every patient deserves our utmost attention. Let's assume your surgery time is scheduled for 10 a.m. You should arrive an hour and a half beforehand. This allows time for your nurse to complete all paperwork, clean and prep the surgical site, start the IV, complete any last-minute test or lab work, and educate you on the pain scale and comfort goal. All patients are asked to set a comfort goal prior to admission to CVMC. A scale of 0 to 10 is used to assess your pain, 0 being none and 10 being the worst pain you can imagine. You'll be asked to rate your pain using this scale. It is also at this time that a certified registered nurse anesthetist and anesthesiologist will come talk to you. It is very likely you will be asked the same questions over and over during your time with us. Please understand that this is a safety and quality practice. When it is getting close to your scheduled time for surgery, your operating room nurse and the nurse anesthetist will meet you in day surgery to take you back to the operating room. There will be lots of equipment, bright lights, and staff with masks and hats on. This is very typical. When you wake up from surgery, you will be in the post-anesthesia care unit. You will still be attached to monitors so we can assess your status. Family or friends are not typically allowed in this area. If you are not being admitted, once all criteria is met for you to leave the unit, you will return to day surgery to prepare for discharge home. There, you'll be given a beverage, and if allowed, family will once again join you. While you are in the post-operative area, we will assess your pain and try our best to get you as close to your comfort goal as possible. Physician's orders will also be given to your caregiver and you. Plus, any follow-up appointments will be made and prescriptions written. You will be given surgical site infection education so you may care properly for the site. Once criteria for discharge has been met, you will be able to go home. But please remember, you will not be allowed to drive for 24 hours, and someone must stay with you during this time period. Thanks for watching. We look forward to your visit, and we appreciate you allowing Catawba Valley Medical Center to be your healthcare provider.